next discussion. So for our next discussion, we are asked to talk about the Duke's criteria and the modified Duke's criteria, which is used in diagnosing what? Infective endocarditis. Duke's criteria and modified Duke's criteria, which is used in diagnosing infective endocarditis. So the Duke's criteria and the modified ones, of course, you should know that they are standardized diagnostic frameworks. You understand? So the things you see in a Duke's criteria, once you see it in a patient, you are 100% sure that what infective endocarditis actually exists. Let me find something to support my back. Okay, so the original Duke's criteria was developed as far back as 1994. Okay, and of course the modified one is now the version that our scientists of our times have actually improved. So major criteria is for you to confirm that somebody has infective endocarditis, you must have confirmed that the person has what? Blood cultures containing some microorganisms that are likely to cause infective endocarditis, like Staphylococcus aureus, like the viridans streptococci, like the Enterococcus. Okay, there's evidence of endocardial involvement. So you can see that there's vegetations of bacteria in the endocardium. There's abscess, that's pus collection in the endocardium. Okay, or maybe you have corrected a valve failure using all those man-made valve and you are having some 1 or 2 reactions around the valve. The minor criteria for Duke is the person's temperature is high, so the temperature is more than 38 degrees Celsius. There's vascular phenomenon like embolized, Genway lesions, intracranial hemorrhage, mycotic aneurysm. Then immunologic phenomena like ulcer nodes, root spots, inflammation of the glomerulus, rheumatoid factor, where the infection is kind of like spreading to the joints, okay, causing all those rheumatoid arthritis. So diagnostic criteria is if you see 2 major criteria, it confirms the diagnosis, or if you see 1 major and 3 minor, it confirms the diagnosis, or if a patient has all 5 minor criteria, it confirms that they have infective endocarditis. So for the modified Dukes, was originally done in 2000, then it was updated in 2023. Okay, so key modifications is they actually expanded the microorganisms that were involved in causing infective endocarditis, and they included what? The Bartonella and the Coxella. Okay, and they also included that you can also dictate the microorganisms causing infective endocarditis using the polymerase chain reaction based methods. So on imaging, they added that you can also use positron emission technologies. You can use a computed tomography, that's the CT scans. Okay, so prosthetic valve infective endocarditis is probably they added it. Okay, then healthcare associated. Okay, so healthcare associated, they were now adding other organisms that can also cause healthcare associated infective endocarditis. So they added methicillin resistant Staphylococcus aureus and the Enterococci. So that's it for the Duke's criteria